I am Charles Asher Walsh, and I am the Senior Vice Chair for Gynecology in the Departments of Obstetric Gynecology and Reproductive Health for Women. Uterine fibroids are non-cancerous tumors of the muscle wall part of the uterus. The uterus is made up of two parts, essentially the muscle wall, which is the majority of the uterus, and the purpose of that is when a woman is pregnant and it's time to give birth, that muscle wall contracts to push the baby out. And so the majority of the uterus is this muscle wall, and then the inside layer of the uterus, sort of like a lining to the cavity of the uterus, is called the endometrium. Fibroids are tumors of these muscle cells that make up the muscle wall. And they are the cells of muscle that sort of go haywire and reproduce and form these tumors that the vast majority of the time are non-cancerous. So we don't really know why they form. It's the uterus is a pretty amazing organ. I mean, there's nothing else in our bodies that go from being about this big normally to like this big in carrying a baby, and then can go back to that size again. So there's something sort of genetically inherent in the way that the uterus forms and develops that predisposes it to fibroids. We know there's a genetic contribution to the formation of fibroids, but they're so common. Over half of all women develop fibroids. It's even a higher proportion in Black women. So it's such a common problem that there isn't anything that's been shown to sort of directly cause or be related to fibroid growth. So the most common symptoms that a woman gets with fibroids is irregular bleeding. Women with fibroids, especially when the fibroids affect the inside cavity of the uterus, will cause them to bleed abnormally. Sometimes it's just simply bleeding in between periods, but much more often the periods themselves are heavier. They can be more painful with more cramping, and they can be longer. So that's the most common symptom. Now, fibroids also, when they don't affect the cavity, may not cause heavier periods, but they can simply cause complaints just from their sheer size. Fibroids, a normal uterus is only 6 centimeters, but fibroids can grow up to 20 centimeters, even bigger. And so with fibroids that are very large, it feels like having a mass in your pelvis. So you can feel a big bulge there. Patients sometimes come in and they've been doing sit-ups, daily forever, and they just can't get their abdomen flat. And it turns out that they actually have fibroids, or they feel a mass there and they feel like they have to urinate all the time because the fibroids sit right on the bladder and keep the bladder from expanding significantly. So they have to urinate much more frequently. So just simply a mass in their pelvis, or pressure in their pelvis, or frequent urination, those are also symptoms of fibroids. And then women who are trying to get pregnant, fibroids can affect both fertility, and then they can affect women later on in pregnancy. Fibroids that affect the cavity of the uterus can make it difficult for women to get pregnant. And these types of fibroids are called submucosal fibroids. And women with submucosal fibroids, their fertility is cut in half, and their miscarriage rate is doubled with these types of fibroids. If they don't affect the cavity, they don't necessarily affect fertility, but they can cause problems later on in pregnancy. They double the preterm delivery rate. Women with any type of fibroid will have a doubled preterm delivery rate. They can cause significant pain in pregnancy, and then they can cause problems around the time of delivery. They can make the placenta shear off prematurely. So those are the primary complaints with fibroids. Fibroids can cause pain sometimes. Sometimes if they grow rapidly and outgrow their blood supply, they can start to die sort of internally without enough blood supply. They continue to grow externally, so some women think, well, they'll just disappear if they're dying, but unfortunately they're just dying internally. But that inflammation can cause a lot of pain. It's called fibroid degeneration. So there are a lot of treatments for fibroids. And one of the things that I often hear when patients come in to see me for fibroids is that the only thing their doctor offered was a hysterectomy. And sometimes a hysterectomy is the best of all the options for a patient, but patients should always be sort of given a number of options, because there always are a number of options for patients. So fibroids first off, don't need to be treated. And occasionally I have patients who are sent to me by their doctor simply because they have fibroids. But the simple fact of having fibroids is not a reason to treat them. You really should be symptomatic in some way or preparing for pregnancy and wanting to decrease your risks in pregnancy. But simply having fibroids does not mean you need to treat them. If you want to treat fibroids, it depends on what the symptoms are. If your symptoms are bleeding, then sometimes you can lessen the bleeding by simply going on birth control pills. A simple birth control pill will regulate a woman's period and decrease their bleeding very often with fibroids. Now, this may not work long term. So for a 35-year-old with fibroids, birth control pills, A, aren't going to stop the fibroids continuing to grow, and B, they may not work. It may not work long term as far as the bleeding is concerned. But birth control pills, a hormonal IUD can also lessen the bleeding. And then sometimes it depends on whether women want to get pregnant or not, as far as what treatments we choose. There are a variety of new treatments for fibroids, but they haven't necessarily been tested in women who want to get pregnant. So the thing that's been around the longest is something called uterine fibroid embolization. This is typically done by radiologists, and they put a little IV catheter into an artery in the groin or in the wrist, and they snake it around with X-ray guidance down to the uterus, and then they inject these little tiny pellets into the uterus that blocks off the blood flow to the fibroids. And that causes the fibroids to die internally and shrink down in size a little bit. It works very well for women who have very heavy periods with their fibroids, and it will shrink the uterus a little bit, but not to a great extent. Unfortunately, it has been shown to have an increased risk of side effects or complications in pregnancy. And so in general, a lot of gynecologists won't recommend it to women who want to get pregnant. That's true for the newer procedures as well. There's a procedure using ultrasound waves with MRI guidance to denature the protein in the fibroids, cause it to shrink down. And the newest treatment that's available now is called radio frequency. It's been around for years in the form of a procedure called the Assessa procedure, which was done fairly invasively with laparoscopy and needles going through the abdomen, but now it's available going through the vagina with a procedure called the Sonata procedure. And essentially what it is it's using ultrasounds going through the vagina up into the uterus, and a needle comes out of the device, goes into the fibroid, and delivers, it's essentially electricity to the fibroids, which is radio frequency, and that causes the fibroids to also partially die and shrink down, and that'll lessen the symptoms as well. It's a very less invasive procedure. Patients the next day are sort of back to themselves. It's done under anesthesia, but the recovery is very quick. After that, you're looking at surgery. You're looking at more invasive procedures, and you can do surgeries to just take the fibroids out, or you can do surgeries to take the uterus out in a variety of forms, either a partial hysterectomy or a full hysterectomy. It sort of depends on other issues that the patient may be having. But that's obviously the most aggressive way of managing this. So there are a variety of ways of managing fibroids, and that's why patients should be given all the options that are available to them. So the easiest way is just simply with an exam, right? Most women should be going for an exam on a yearly basis, and part of the pelvic exam is just doing what's called a bimanual exam with one hand in the vagina and one pushing down on the abdomen. And for the vast majority of women, we can feel if the uterus is enlarged, right? Women should not be getting yearly ultrasounds. And a lot of women who are concerned for ovarian cancer or fibroids very often push for yearly ultrasounds. But especially with fibroids, where fibroids are not cancerous, the vast majority of fibroids are not cancerous, and they don't necessarily need to be dealt with unless they're causing symptoms. So unless a patient comes in with a complaint, with increased bleeding, with irregular bleeding, with increased pressure or pain in the pelvis, simply thinking that they may have fibroids is not a reason to get an ultrasound. Once you get an ultrasound, if you're considering doing something about the fibroids, if you think the uterus is enlarged by exam, that can be a reason to get an ultrasound. But an annual ultrasound has not been shown to change any outcomes, but it does significantly increase the risk of having an unnecessary surgery, because when we do ultrasounds, you can't help but look at the ovaries, look at the tubes, and if there's any sort of cystic structure, which a lot of women have naturally, we can never be sure it's not cancer, and women wind up having a lot of unnecessary surgeries for routine ultrasound. So really all a woman should have is an annual pelvic exam, and then go from there if there's a problem. There's a variety of studies that show that are not really conclusive in showing, looking at things like diet, for example. And so a lot of some studies show that a diet high in soy, which in the body, soy is converted to estrogen. Estrogen has been shown to stimulate fibroid growth. So there are some studies that weakly show that a high soy diet can potentially increase the risk of fibroid growth. So there have been some studies looking at meat in your diet, looking at the risk, especially a lot of meat now. Chicken, for example, can have a lot of hormones injected into them, and there's some theories behind whether that impacts fibroid growth. But there really aren't good studies that are consistent with increased growth related to that. Because fibroids are so common, again, over half of all women develop fibroids. We don't really think that there is something that someone does that significantly increases that risk, because they're so common to begin with. And there are so like we talked about before, there is an increased risk in certain women, Black women, for example, have an increased risk of developing fibroids, so they're disproportionately affected with fibroids. But there isn't anything in particular that one can do to avoid the development of fibroids. So as we discussed briefly before, they can have that effect, especially if they affect the inside cavity of the uterus. And most fertility experts will tell you that if you have a submucosal fibroid, a fibroid that affects the cavity, you really should get that removed before trying to get pregnant, because doubling the miscarriage rate, having the fertility can, is a significant effect on women trying to get pregnant. It's a very emotional time, and when the body doesn't work perfectly well and you're trying to get pregnant and you're not successful, it can be difficult, not just physically but emotionally. And since we know those things negatively affect fertility, usually we recommend getting fibroids out if they affect the cavity. Now, if they don't affect the cavity, they can affect pregnancy later on, like we were talking about. And a woman without any risk factors for preterm delivery will still deliver preterm somewhere between 8 to 10% of the time. That number is doubled if you have fibroids. So women with fibroids, 1 in 5 will have a preterm delivery, and preterm delivery is anytime before 37 weeks. Full term is 40 weeks, or the due date is 40 weeks, but full term is considered 37 weeks and beyond. If you make it to 35, 36 weeks, most of those babies do fine, but there is a risk of problems from prematurity. And before that, there can be real problems, sometimes lifelong disabilities with prematurity. So, when I discuss this with patients, I sort of tell them that obviously we can't predict if you're going to deliver prematurely. We can't predict if it was going to happen, even if you didn't have fibroids, because it happens 10% of the times. But it's important to sort of think about how they would deal with this adversity, because it can be very challenging to deal with a baby with disabilities from prematurity. And so if they're the type of person that's going to sort of beat themselves up for a long period of time, because they didn't do something, then that honestly is a reason to consider doing something prophylactically, so that they can focus on their child and the needs of their child. If there's someone who's going to say logically, we still had a 80% chance of everything going fine and we played the odds, then maybe they don't need to take the fibroids out. But that is something to sort of think about it on an individual basis. Well, emotional stress can cause a lot of problems, that's for sure. As far as we know, there is not a direct relationship with stress and fibroids. There seems to be a relationship between stress and irregular bleeding, heavier periods sometimes, but I've not seen a study that's shown that fibroids grow more often or faster with because of stress. The most common complications are the bleeding issues, and because fibroids they're not cancerous, they're not going to kill you. It's extremely rare that somebody will die as a result of fibroids. So because they just affect the quality of life. A lot of women live with fibroids and the symptoms of fibroids for years before they finally decide to do something about it. And it can be a real challenge for women when they have severely heavy periods. Sometimes they're limited for the 5 to 7 days during their periods when they're really heavy because they're bleeding so much they feel like they can't go out, they can't participate in normal things, they can't go to work. Um, and but then it ends, and when it ends, most of us are very positive thinking, and they think, maybe this won't happen next time, and so they go on with their lives. They catch up with the things they were missing when they had their period, and they don't sort of schedule doing something about the fibroids. But the rest of that month, their body's busy trying to make up for the blood that was lost during their period. So they're tired. Women with fibroids and heavy bleeding are very often tired all the time. They feel like they can't exercise, so there's weight gain. So it's the bleeding that's sort of the biggest problem. As fibroids grow, they can become uncomfortable. They can make you urinate more frequently. And those are things that eventually make a woman sort of pay attention to the fibroids. But the bleeding is what sort of brings most women to us for fibroid care. Most important thing is just to remember that there are a lot of options for fibroids. There's some newer medications that have less side effects that we have that can sometimes control the bleeding with fibroids. There are very simple things that you can do if you have fibroids to suppress fibroid growth. Vitamin D, for example, has been shown in numerous studies now to suppress fibroid growth. Green tea extract has been shown to suppress fibroid growth. So there are natural things that are healthy in general. Most doctors, endocrinologists, in dealing with diabetic patients often recommend vitamin D and green tea extract for their patients, internists in general. But unfortunately, most gynecologists don't read the studies that look at alternative treatments like this, homeopathic treatments. And so a lot of times women with fibroids won't be given these recommendations. They'll be told if they're not bothered by their fibroids that they should just live with them until they become a problem. But by the time they become a problem for some of these women, sometimes the alternative treatments aren't so great. Embolization, radiofrequency, they don't shrink fibroids very dramatically. And so women with really large fibroids, by the time they become a problem, if they aren't having bleeding issues, sometimes the only option is surgery. So I do think it's important to try to do the things we can do when the fibroids aren't that symptomatic, and vitamin D and green tea are really helpful in that.